Hello, friends. I guess you have seen that we started the YouTube channel. I haven't spent a lot of time on YouTube to really know what people from the medical field, what they talk about. But what little I have seen, it seems like most pontificate about what they're interested in, what they can do. And I think maybe this channel should be a little different. This channel is primarily about patients with chronic UTIs that have been unrecognized and obviously untreated. So I was thinking maybe doing something a little different, and that this is a condition where the patients know exactly what's wrong with them. They have a undetected, untreated UTI that may have gone on for 3 weeks, 3 months, 3 years, or 30 years. So the problem is not so much the patient. Really the problem boils down to the physicians who are not sitting down, listening to the patient, and helping the patient identify their problem and go on to a treatment that's successful. So I thought what we might do is we would want to talk to, we really want to talk to patients. We really want to set examples, how to talk to patients with these problems. Again, these problems can be anything from recurrent UTIs, overactive bladder, painful bladder syndrome, interstitial cystitis, because that's really just a spectrum of the same condition, which is chronic bacterial cystitis. The so-called intraepithelial bacterial communities that live inside the urothelial lining that can cause pain, can cause irritation. Irritation of the bladder causes frequency and urgency, and many times this is associated with painful intercourse. So what I want to try to do is I want to try to get some feedback. So we can actually interview patients on this channel to try to set an example for doctors that realize that there's a problem that's not very well identified. I mean, clearly we as doctors have patients that we know have a problem, but we can't put our finger exactly on what that problem is, how to diagnose it, and how to treat it. It really goes back to when I kind of stumbled upon the diagnosis, and really how all this got started was, I'd say 20 years ago, probably about 20 years ago. I had a patient. She was a middle-aged female patient. And I was probably maybe 3 to 5 years out of my residency. And she was miserable. She was miserable. She had severe frequency, she had severe urgency, she had 10 times getting up at night, pain, burning, just living a miserable existence. And I sat there and I told her, well, there's just nothing wrong with your bladder. I mean, look, this is your urinalysis. Your urinalysis is normal. There's no blood, there's no pus, the nitrites are negative. But nevertheless, there she was in the exam room, bawling her eyes out. And I remember that patient to this day because I wasn't there for her. I had empathy, but I knew I didn't know which way to go. I didn't know what to do. So I essentially told her that there was nothing wrong with her, when in fact there was something wrong with her. And then probably within the next year or two, I had one patient. I had a patient that had an infection. She came to the office. She has burning, frequency, urgency. Gave her a week of antibiotics. I don't remember what I used. Did a urine culture on her, and she improved, and she came back a month later. Same story. And I said, well, I'll show you. So I put her on 2 weeks of antibiotics. But I did a culture also. And when the culture came back, it was the same organism. The interesting thing about this organism is it had a very, very unusual resistance pattern. You know, we know these bacteria by their name, but they're cousins. And so we identify the cousins by their resistance patterns before DNA testing came along. And so I didn't think much about it. It was clearly the same organism. And that's real common. Most of them are E. coli. But the resistance pattern was the same. And I thought that was kind of weird. Because, of course, recurrent UTIs are just recurrent UTIs. It would never be from a persistent UTI. Well, in fact, I treated her for a couple of weeks, and she did really good for 4 or 6 weeks, and she came back. Same story. Got a culture, put her on antibiotics, and this time I noticed on the culture, same organism again. So I thought that's really odd. So I said, well, I'll show you this time. So I put her on a month of antibiotics. Did great for 3 months. Came back. Same story, same identical organism. Then it hit me. It hit me like a ton of bricks. It was like, oh my gosh, these are not new infections that these people are having. This is the same organism. This is a persistent infection that intermittently is exacerbating. So I said, well, I'll treat you even longer. So I treated her for 2 months, which at the time, my way of thinking was absurd that you would have to do that. Now, these are not, this is not, at night antibiotics to suppress. This is to kill. This is to cure, intent to cure an infection. She did really good for about 6 months. Came back. Same story, same organism, same resistance pattern.